Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Gaulin.
Hey everyone, welcome back to the Gastro Girl podcast. I'm your host, Jacqueline Gaulin. I'm sure those of you who are living with IBS know that it isn't just about managing physical symptoms. It's also about navigating the emotional toll that often comes with this condition. In this powerful episode, we're joined by Dr. Sarah Ballou, a GI health psychologist and director of the GI psychology services at Beth Israel Deaconess Medical Center. She'll help us explore how fear shows up in the IBS journey and how to face it with strength and support. Thank you, Dr. Ballou, for coming back on the show. You're such a hit with our audience. They love you, and we really wanted to have you come back again because you did such a great job on our last episode. So welcome back.
Thanks so much for having me.
And this is such an important topic. I know we've done a lot on IBS, IBS-C, but there's so many complexities as you've identified in your previous episode. So for this episode, just to start us off, can you help us understand what kinds of fear are most common for patients with IBS-C?
Sure. So I think first I'll just start briefly with some of the fears that kind of transcend the bowel subtype, so are common in IBS, C, D, and the mixed. And that would be fear of kind of like abdominal pain, abdominal bloating, or discomfort in the contexts in which they might occur. So that can happen regardless of what your bowel habits are. And oftentimes patients feel fearful about whether they would be able to handle it or if they would be able to kind of cope if it were to happen in an inconvenient time. Also, a lot of patients with IBS and including IBS-C report fear of certain foods. You know, is this food going to make me feel sick? Or what if I eat that and I feel bad when I'm out with friends, for example. So those are fears that are really common in IBS-C, but aren't specific to IBS-C.
Yeah, no, sorry. So like some of the top fears, just to put it into perspective, is it like the flares, having an issue, maybe have to run to the bathroom, being afraid, travel, like some of those things?
Yeah. So, I think for IBS-C, it's a little bit less fear of kind of like a sudden flare or fear of travel compared to the IBS-D patients who might be having more urgency. Although certainly patients with constipation can experience overflow diarrhea, so they can have those symptoms of diarrhea, even though it's because they're so backed up. I hear my patients with IBS-C talking a lot about like real worry about what does it mean if they don't have a bowel movement every day, that there's really this myth that we all should poop once a day in order to be healthy. But really, the normal range is going 3 times a week to 3 times a day. And kind of anything within there is considered healthy and appropriate or a normal. I also hear patients with IBS-C really talking to me about fear about what does it mean to be on a medication or to need a medication to move their bowels. And this idea that they really should be able to do this without a medication. And so I think there is underlying a fear of, what if I have to take this forever? And what does that mean about my body if I always need help going to the bathroom? IBS-C tends to have more kind of interpersonal or kind of more private fears. So things about fear about intimacy or fear about kind of being able to be fully present if you're super uncomfortable with constipation. Whereas the patients with diarrhea have more of those fears of travel, leave the house. Will I be able to make it to a bathroom?
No, that's really insightful. It's amazing like how much a condition or a symptom like IBS-C can really impact someone's daily routines and mental health. Can you explain a little bit about how those two come into play?
Yeah, IBS-C can be so impactful on the daily routine. So many patients that I've seen have really rearranged their schedule so that they can have ample time in the morning to be in the bathroom, to give their bodies time to kind of get moving. Sometimes there are rituals or processes that they go through, stretches, exercises, kind of certain foods that they eat to promote a bowel movement. And this can kind of really creep into one's schedule so that, it's not uncommon for me to see a patient who, would like to work a 9 to 5, but is now working, 10:30, kind of starting at 10:30 and then working later into the day so that they can start their morning kind of with enough time in the bathroom. On the surface, that might sound like not like such a big deal, but it really can end up then bleeding into other things that they would like to do with their family or friends, maybe in those after work hours.
Yeah, now you're such an expert in clinical psychology, and you've done some amazing research. We've touched on it in our previous episode, and I wanted just to delve into that a little bit here with the mental health aspect. All of these things that you just mentioned. What are you seeing in your practice regarding the mental health aspects of having a condition like IBS or IBS-C?
Yeah, it can be so discouraging and so frustrating, right? We know so much about the brain gut axis, and we know, of course, that having these symptoms can cause anxiety, can cause emotional distress, which can then impact our sensitivity to sensations in the gut, or even how quickly or slowly things are moving through our digestive system. And so there really is this loop of, I think, sometimes feeling so frustrated or even sad or depressed about how um, one's daily activities have been impacted either by symptoms or about fear of symptoms occurring, um, that then can contribute to worse symptoms. So I think I see a range of different emotions. Sometimes it's anxiety, sometimes it's a touch of depression. It's not always clinical anxiety. It's not always meeting the criteria for a full diagnosis of an anxiety disorder or for a diagnosis of major depressive disorder, but it does kind of bring up some of those emotions, even if it's not meeting that full criteria.
No, thank you, Dr. Ballou. Before we keep going, I just want to point out to our listeners, we want to present this information in a way that's empowering for patients. So this episode, we're not trying to just talk about all these fears and create this negative situation. What we're trying to do is show patients that you're not alone. So the plan for this episode is, with Dr. Ballou, is to kind of lay out these fears so that you don't feel like you're alone with this. And then we're going to delve into some tools and some tips to overcome some of these fears so that you leave this episode with some practical insights on how to go forward in your journey. So I just wanted to say that. I should have said at the beginning, but I just got so excited to talk to you about this right away. And I forgot to say that. But so don't worry, this isn't all doom and gloom, listeners. We want to we want to bring you in and let you know you're not alone by showcasing some of the fears, and for maybe caregivers, so maybe they can better understand a loved one who's going through this. So with that said, my next question is, how do you find that these fears differ? Do these fears differ based on how long someone has been living with a condition like IBS-C? Are there scales of
Yeah.
that or different milestones that happen with the patient journey?
Yeah, I think it really depends on the individual. And we have to also remember there are a lot of people in the world who meet the diagnostic criteria for IBS-C, but have never consulted with a doctor for it, right? And so there are people out there who have been living for a very long time with these symptoms and have found a way to kind of work with it, or to find enough relief that they've not even gone to see the doctor. So those patients, I would say, have maybe had these symptoms or those people have had these symptoms for a long time, and maybe with time have found a way to adapt. I think, the longer you have these symptoms, of course, it's possible that you could get more bogged down by it with time, but it's more likely that you'll find ways to adjust and adapt that work for you, and that kind of, with time, ultimately help you to feel a little bit better or more confident.
And do you notice any commonalities in the way that fear shows up in their lives? Are you seeing any common threads?
I think behaviorally, the most common thread is kind of just working really hard to carve out time in one's day to make sure that there's enough time to promote a bowel movement. Um, Otherwise, I do think it's pretty individual with how is this impacting one's day to day, and also what's working and not working for people. When someone first experiences symptoms of IBS-C, so constipation, abdominal pain, maybe bloating, it's more adaptive in those first weeks and months to do less, right? To say, let me pull back, let me evaluate what I'm eating, let me maybe try to make some changes in my diet or changes in my schedule to see if this helps. I think in the early stages of, these symptoms starting or getting a diagnosis, that's actually totally healthy and even helpful to say, let me just take a pause and see how I can feel better. With the patients who have had it for longer, sometimes those things that were helpful in the beginning then become less helpful. And that's kind of where like a behavioral intervention would come in to help someone really take a look at what are you doing, what's helping, what used to help, and maybe what's not helping so much anymore.
So that's where a patient could tap into your expertise as a clinical GI psychologist, correct?
Yeah. Yeah. I mean, sometimes it's really hard work, right? So if a patient has found something that they think is working, in some ways, but maybe is impacting their quality of life in others, it's hard to take the step to say, okay, let's experiment with this. Let's see, can you leave the house a little bit earlier? Or what if you had to use, go sit in a public bathroom for a while, right? So it can be really hard work, but ultimately, many patients find it very helpful.
Yeah, I'm going to go back to that in a minute because I think it's a really important, the role of GI psychology in patients that have IBS-C and other GI conditions. So I just want to touch on this. You mentioned this earlier, that one thing we hear a lot about is that being afraid and having fear about trying new treatments. Why does this happen, and what do you see in your practice when patients
Yeah.
have IBS-C? I know they maybe have tried some of the over-counter, and maybe their
Mhm.
doctor prescribes some prescription, or maybe they've been
Yeah.
on a prescription and now they want to try a different one. How do you navigate that with patients, and what do patients need to
Yeah.
think about?
Yeah. I mean, sometimes I think there's a fear of side effects, or some patients might have had previous experiences of not benefiting from medications and then feel apprehensive or maybe even ambivalent about whether they want to try something new. But and a common thread, and I know I touched on this earlier, is this idea that I shouldn't need this medication, right? I think many patients have the belief like this is something my body should be able to do, and so I want to do it without the medication. And sometimes I find patients really kind of stuck in this. I want to feel better. Maybe the medicine will help me feel better, but I also really want to do it without the medicine. And so it's kind of sometimes this worry or fear about what would it mean to take the medication to feel better, and even then to realize you need that medication. So it can be complex.
Thank you for that information, Dr. Ballou. The next question I want to ask is, how can this fear lead to avoidance or a loss of trust in providers?
Mhm. Yeah, I mean, I think the loss and trust of providers might come from fear of not doing well, but it also might come from discouragement, if prior recommendations haven't worked. And it can take a couple different iterations of, treatment plans for a patient to find relief. I think it can be super disappointing to feel like a medication's not working for you, or to feel like, what if I try it again and it also doesn't work? So, that's something that patients can talk to their providers about. And I think the more open they are with their treatment team, probably the more likely they are to kind of get the reassurance that they need to keep going.
I find it so fascinating, the connections of things, right? So when someone is so fixated on trying to have a bowel movement, and then the fear, then there's anxiety. And I know
Mhm.
that we think that that is only associated with diarrhea. How can that stress in the body that's
Mhm.
maybe coming from the fear and the anxiety, how can that impact the actual ability to have a bowel
How things
movement?
move through.
Yeah.
Yeah, I mean, we do tend to think about someone like rushing to the bathroom, for example, like before they give a big presentation or before they have an important meeting, right? The brain gut axis also can contribute to slowed down, or things kind of not emptying quite as fast, right? And so if we think about what the fight or flight response does, right, when we're very anxious, very nervous, and our body's mounting this stress response, actually in the moment of stress, it slows everything down, right? You're supposed to be using your body's energy to run for your life or fight for your life. And we mount this response in traffic, in interpersonal stressors. We're not always necessarily needing to run for our life or fight for our life, but our body responds in that way. And so when that fight or flight response is turned on, actually everything just sits in your digestive system so that you can use all of your energy not to digest, but rather to survive. The diarrhea usually comes after, actually, when your body turns off that fight or flight response, and then kind of everything dumps. And so there's different stages of kind of how our bodies respond to stress. And I guess my best explanation is that some people kind of like lean towards dump everything and have diarrhea, and other people respond to kind of stress and this fight or flight system by slowing things down and holding on to.
Yeah, I think that's such a great point, because sometimes we may not realize that if we're so anxious and stressed, that we may be perpetuating this state because your
Mhm.
body's just holding on to everything
Mhm.
in a
Yeah.
response to that. So I think
Yeah.
I know that I like to understand how things work. So I'm thinking our listeners do too. And maybe I hope that gives them some insight to go, oh, it's not me. Like there's something that's happening in my
Yeah.
body that
Well,
I
and
need to
this is why
understand.
we often are talking about diaphragmatic breathing. And I think it's a tool that sounds so simple, that's easy to say, like, I've been suffering so much, breathing is not going to help me. And I get that, right? It almost sounds too simple, too good to be true. But what diaphragmatic breathing does is it taps into the rest and digest response. So it teaches you to turn off that fight or flight and to turn on your rest and digest, so that you're better able to kind of counteract the fight or flight system when it's turning on a little bit too often.
Can I put you on the spot and ask you to do a little demo for
Oh, of
people that may
course.
be listening? Maybe this will help them.
Yeah, absolutely. So the idea with diaphragmatic breathing, it's also called belly breathing. We're taking these really beautiful deep breaths in, filling your lungs completely. And when you do that, your diaphragm, which is a sheath of muscles underneath your rib cage, underneath your lungs, pushes down. When your diaphragm pushes down, your belly moves up and out. So this is why it's called belly breathing. We're going to inhale, your belly will move up, and exhale, your belly will move down. Okay, so we can practice this a little bit. Breathe in through your nose, feel your belly rise, and then out through your mouth, and feel your belly gently fall. Every time you breathe in, feel your belly rise and feel your body start to relax just a little bit more. And every time you breathe out, you can imagine you're releasing any tension you might be holding in your body. With every breath you take in and out, with your belly rising and falling, you might even notice your heart rate coming down, your muscles starting to relax. Some people notice tingling in their arms or hands. These are all signs of deep relaxation. You can take 2 more deep breaths, feeling your belly rise and fall. And 1 more breath, and then back to your regular rhythm of breathing. You can just check in to see, how does your body feel now compared to before those first few breaths. It sometimes takes a little longer to achieve full relaxation, but actually a couple breaths, 3 or 4 or 5 deep belly breaths can have an effect.
Yeah, I feel like I need a nap now. You have the perfect voice for that, by the way.
Thank you.
That's great. So if we do that, will we get like 6-pack abs too? No, just kidding.
No, actually, that's a good point. If you find that you're kind of pressing your
Yeah,
belly
you're not
in
doing
to
it right.
exhale, you're not quite doing it right. So you're supposed to kind of like feel your belly rise and then just let it deflate on its own, right? So if you press back in, you could actually even end up contributing to like more feelings of bloating or things like that. So it's not a way to a six pack.
Okay, just thought I would ask. No, but thank you for that. I hope that helps our listeners. Since it's in the moment,
Mhm.
they're listening, and you have the perfect voice for that. Very relaxing. That's awesome. So my next question, and this is some tips now. How do you help patients who say nothing works? I'm so afraid to try this again. I'm done with this. I'm
Mhm.
over. I'm so frustrated. Like, how do you
Yeah.
address that? And what would you say to patients to have a different mindset?
Yeah, I think we first need to recognize what fear is, right? It's your mind trying to protect you. So I think number one, we don't want to say like fear is bad, let's change it from the get-go. We want to kind of stop and honor and even have a little bit of gratitude for kind of what our mind is trying to do to protect us from some perceived threat or unwanted outcome. And then I think the next step is to really identify very clearly and specifically what it is we're afraid of. So often we kind of stop at the, I don't want to do that, it's going to be bad, or I don't think I'm ready for that. But we don't actually then let ourselves say out loud or even write down what it is that we're afraid is going to happen. So even though it might sound even a little kind of counterintuitive,
Mhm.
even saying like, okay, well, what is the worst case scenario? Like, let's go all the way to what the worst possible outcome would be. And let's kind of work back from there. What would you do if that happened? Could you handle it? Have you been through something like this before? Sometimes taking our fear and really sitting with it and kind of thinking very specifically about it, as uncomfortable as that can be, actually helps us to see, okay, well, if that happened, like I know what I would do. I wouldn't like it. I don't want to do it, and I know what my plan would be. And then the other is to kind of, really say, is this fear helping you? Right? Sometimes fear does help us, right? Like we don't play with fire because we're afraid of setting things on fire. Like that fear is really helpful,
Yeah, that's
right?
true. Yeah.
And so I think to even identify like what is your fear, and actually is this one a helpful one that actually is keeping you safe?
That's a great advice. I love how you frame that. Fear
Mhm.
is not necessarily a bad thing.
Mhm. Yeah.
Um, so my next question is, what is the role of the brain gut connection what role does it play in reinforcing this fear, perhaps?
Yeah, I mean it's a cycle, right? Like we have fear, we have worry, we have apprehension about how things are going to be, and those all turn on that fight or flight response, and those can all affect how is our body interpreting signals of pain and discomfort. It ends up making it feel stronger, and how is our body kind of moving things along in our digestive system. So the more fear and anxiety we have about how things will go with our digestive health, the more likely we make it that we're going to experience pain, we're going to experience discomfort and potentially changes in bowel habits. And then, of course, those in turn become a stressor, become a source of anxiety. And so we really want to think about breaking this cycle. We can break the cycle from the top down to say, like, let's address the fear, let's address the worry, let's help you to feel like you have tools to cope. And also from the bottom up to say, let's go to a gastroenterologist, let's get a medication. Let's see if you can take something that actually does resolve some of these symptoms. And I think working on those two things at the same time is the best way to really break this cycle, especially the ones that have become like really deeply entrenched in that cycle.
Yeah, and you mentioned that before that people start avoiding plans or isolating
Mhm.
themselves, and this like that contributes to the
Mhm.
circle, shrinking their world. It shrinks their world, and
Mhm.
maybe increasing the symptom focus. So, what are your tips for patients in that aspect?
Yeah, patients need to think about what are they not doing that they would like to be doing. And some patients actually have a hard time answering that because they've kind of become so set in this, like, this helps me, so this is what I want to be doing, that it can take a little while to think back, like, before these symptoms started or before I changed my routine, what was it that I enjoyed? Or if, we could wave a magic wand and all the symptoms disappeared, what would you picture your life kind of having, right? And then we think what's realistic to add back in, or what does a patient feel ready to even take like a baby step to say, let me just see if I could do it. Let me see what that would be like. So these are behavioral experiments, and at the same time, we would be addressing like what are they worried would happen. They don't always go well. Sometimes patients will go out and do something and it is exactly what they were afraid it would be like. And then we revisit and say, how can we modify that thing to still get you back to doing things that you would like to do?
Yeah, no, I think we've turned a corner in our conversation, and I want to shift the focus now to the hopeful things. And what tools or strategies do you recommend to help patients feel less fearful and more in control?
Yeah. So the first one I think we already touched on is identifying specifically what are you afraid of, and then thinking really practically and logically about this. Is this helping? Is this fear helping me? Is there any other way to see it? And am I willing to kind of introduce some flexibility into this thinking to give myself the room to see if anything will change? And then always also, guided relaxation, diaphragmatic breathing, kind of helping your body to feel calm and relaxed is a great way to not only promote a bowel movement, but also to, kind of help you feel more confident in your body's ability to go out into the world, even if it's a place where you don't feel super comfortable, and kind of see if you can take your symptoms with you to the activity that you'd like to do.
That's great. And what is the importance of small, safe steps? And the follow up for that is, what are some small wins that the patients can look for?
Mhm. So small wins, we don't usually start by jumping into the deep end, right? So small wins would be if you usually feel like you can't leave the house until 10 o'clock in the morning, can you get out by 9:45, right? Can we like creep earlier and earlier? A small win, which I think is the best way to get to the big win, would be, could you go to whatever the event is for half an hour, even if the event is 3 hours long, right? So I think to kind of allow yourself to say, like, I'll do a little bit. Maybe I can't do it all right away, to kind of work towards whatever it is that you are hoping to achieve.
And maybe if we put this in the perspective of being in the doctor's office and being faced with maybe trying a new medication, what
Mhm.
could be a small win there?
I think a small win there would be to really have an honest conversation, right? It's hard for anybody to read your mind, right? And so I think if you say, This is what I'm afraid of," or "This is why I'm hesitant to start," then you can really have an honest and informative conversation with your gastroenterologist, who is the expert and who has a lot of experience kind of seeing how patients have done with this. So I think the more open you are with your physicians, the more honest you are. It's not going to sound silly because providers or clinicians who have been treating constipation for a long time have heard this before, even if it does feel like you're alone in it, you're not, right? This is a conversation that's happening all the time.
I'm glad you brought that up because it leads me to the importance of shared decision making, which we
Hmm.
talk a lot about in most of our episodes. What does shared decision making look like, especially when there might be a little bit of fear in the room?
Yeah. I think my medication is only going to potentially help you if you take it, right? And so I think shared decision making is, this conversation about you know, telling your physician when you feel something about trying a new medication, asking your questions, making sure that you have, a physician or a clinician who is able to kind of sit and hear you out. And so I think it's important to ask all your questions. It's important to put on the table what your concerns are, but then it's also important to be willing to hear what the clinician has to say and what their recommendations are.
That's a great tips. Dr. Ballou, I love when we have real life examples. So I thought maybe you could share a story without identifiers of a patient who maybe came to you fearful and found relief or hope in their journey and what that looked like.
Yeah. I think I've been drawing on this example in some of what we've talked about earlier, but what comes to mind is, and this I suppose would be a combination of a handful of patients who have had similar situations, but a patient who knew that they were up for a promotion at work and really wanted the promotion at work, but was very fearful about what that would mean in terms of their flexibility. Could they work from home? Would they still be able to kind of have the flexible morning that they liked to have? And I'm thinking of kind of these, a handful of patients who were really tempted to pass up on an opportunity that they had worked so hard towards and really wanted. And, I think that's a really profound kind of like illustration of how disruptive some of these symptoms can be in terms of patients feeling confident to kind of go out and do what they want to do and achieve their goals, right? And so with that patient, we luckily had the time to think ahead about what would kind of make a strategy in terms of a behavioral plan to start to experiment with go to Starbucks in the morning, grab a coffee and go home, right? Or go to Starbucks in the morning and go to the bathroom at Starbucks, or try to go to the bathroom at Starbucks and then go home, right? And kind of like creep up to what it might be like to get to work early, need to have a bowel movement at work, and kind of feel confident to do that while also, stepping into a bigger role.
Oh, that's great. I know we're coming up on time, but what are your final tips for patients who may have IBS-C and they're listening to this and they want to take the next step? They feel maybe a little bit of encouragement. What
Yeah.
advice could you offer them?
Yeah, so I think the fastest thing to be able to kind of start to incorporate would be meditation or guided relaxation practice daily. Like I said before with the breathing, it can sound kind of silly, right? These symptoms can be so big and can feel like such a huge kind of part of your daily life that sitting down for 5 or 10 minutes of a daily meditation sometimes doesn't feel like it should be that impactful. But there's really good research that it is, that teaching our bodies to relax, teaching our muscles to kind of like let go and unwind, actually can not only help with anxiety, stress management, but can also help with these digestive symptoms. So, first thing I would recommend for someone who's listening that wants to get to work today would be download a meditation app or a guided relaxation app and find some recordings, even on YouTube, and just, go ahead and try that every day. And then if you think you need a little bit more, then I think it's time to have a conversation with your gastroenterologist or your primary care doctor, whoever is kind of managing your constipation with you, about, are there behavioral or psychological supports that you could use or someone you could talk to work through some of like this fear or anxiety.
Yeah, that was going to be my final question is when to see a GI psychologist and how a GI psychologist could help someone with IBS-C.
Yeah. So I think when to see one is as soon as you feel like you want one, if there's one available, right? It's not
Yeah.
always easy to access. But I think if you feel like fear is bogging you down, worry about symptoms is bogging you down, you find yourself really, anxious or concerned, not only about your symptoms, but also about symptoms that haven't happened yet, right? Like even if you wake up in the morning and you feel good, if you start thinking, what if I feel bad by the end of the day? These are all things that a psychologist could help you to find coping techniques to work through so that it doesn't kind of feed into that cycle of worry and symptoms and worry. For those patients who don't have access to a gastropsychologist, because even though there's more and more every year, there still, in my opinion, aren't enough. And then I think finding even just a more general mental health psychologist and maybe somebody who has experience treating other chronic medical conditions or chronic pain, they would be able to help out with some of kind of these symptom specific fears or anxieties.
Oh, thank you. Well, Dr. Ballou, this has been, as always, just so insightful and so helpful. And thank you so much for your insight, warmth, and guidance today. To our listeners, remember that fear is a real part of living with IBS-C, but it doesn't have to stop you from getting better. With the right support tools, you can build confidence and create a plan that works for you. If this episode helped you, please share it and subscribe, and check out more resources on gastrogirl.com and in the Ask Gastro Girl app. And remember, you're not alone and you're more resilient than you think. Until next time, take care of yourself and your gut.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.